Orlando Health for having us back, and thanks for all the great work that they've done here, and been a great source of information and advice for us throughout the whole course of this. So I want to thank them for doing this. I'm going to just give a quick overview. Halsey's going to have an announcement, Secretary Beshears on the DBPR front, and then we're going to talk to the doctors about some of the stuff. But first, Dr. Rawls, did you want to just say anything on opening?
Sure. So first, Governor, thank you for coming to see us again. And we're certainly very appreciative of the attention you've given to Central Florida through this event. We've got some good information to share. Looking forward to informing everybody about where we are and where we will be as we move through this. And again, thank you for spending that time with us.
Absolutely, and thanks so much for your help. So we're closing in on 1.7 million tests. Been doing a lot. Obviously, that's escalated a lot in the last month. We're going to continue to doing that. We finished if you look at the state of Florida and nationwide, I think pretty much almost every state at least reports it the way Florida does. The majority of the fatalities associated with COVID-19 have been folks who were residents of long-term care facilities. The median age, according to CDC nationally, of COVID-related fatalities, I think is 80 or 81. In Florida, I think it's a little bit higher, and we've had more COVID-related fatalities over the age of 90 than we've had under the age of 65 throughout the course. And so the long-term care facilities has been one of the top priorities. We've now gone through and either tested or at least offered a test to every resident of our long-term care facilities. We have over 4,000 facilities in the state of Florida, and we have tested the staff, or at least offered a test to the staff. And as of this point, almost 80% of all those 4,000 plus facilities have not had a single COVID case, either resident or staff. So we believe that that's an important thing to keep going. We're going to be launching on Friday our testing program to test all staff at long-term care facilities once every 2 weeks. And we believe by continuing to do that, trying to identify particularly the asymptomatic spread. When the workers come in, they're required, and we've provided PPE, they get temperature checks, they get screened about any type of contacts, which is important. But you have a virus that a lot of times is either mild or has zero symptoms for a lot of people, particularly people in the age groups that may be working at some of these facilities. So we think it's important to continue to do the PCR testing on a regular basis. And so we are going to be doing that. Now, one of the things we've been seeing, important to protect the vulnerable because that's where most of the clinical consequences are, and that's been our focus really from the beginning of this, both in terms of the long-term care facilities, but then also just advising our senior citizens not in those long-term care facilities to make sure they're avoiding crowds and maintaining appropriate social distance. What we've seen, particularly over the last week, is a real explosion in new cases amongst our younger demographics. And so when we started this in March, the median age of people who tested positive was, I think, 65. As the testing ramped up, that went into the 50s, but it was pretty much in the 50s for most of the time. And then just recently has really plunged so that last week the median age was 35 years old. So half of these positive tests are in that 34 and under age group. And the bulk of the tests that we're seeing are really the 25 to 34-year-olds. They represent the largest share of all positive tests by pretty decent margin for anyone throughout the course of the pandemic. And they weren't even really being tested very much in March. And so that's a big change. And then if you look here in Central Florida, the median age of new cases for yesterday that was reported today is even younger, 32 in Orange, 32 in Seminole. Orange has even been younger over the last week. It's been, I think, 29, 30. Seminole, I think, has been as low as 27 or 26. So you see how this is kind of skewing. Now, the good thing about that is if you look at any data set, the folks in that age group, unless they have a real serious underlying condition, do not suffer the same types of clinical consequences, whether hospitalization or certainly COVID-related fatalities that people in the older group would do. And in fact, even though we had a lot of new tests at higher levels last week, we actually had fewer positive tests with our long-term care facilities than we had. So that the cases there actually went down, which was a good sign. But what we're seeing is part of that is some of the contact tracing and some of the discrete outbreaks we've seen around the state, but really most of it is community transmission, particularly amongst the 20 and 30-year-old group. And I think part of that is just natural. You kind of go and, you want to be doing things. You want to be more out and about. I think the folks who are a little older and would be more vulnerable have been a little bit more careful. So you're just seeing, I think, more contact, and that's why you're seeing this. I'm going to talk in a minute about what we're kind of going to do going forward. But clearly, you're seeing this. This is real. Now, they are testing more than they were for sure, but they're also testing positive at a higher rate than they were before. And so that would tell you, there's probably been an escalation in transmission over the last 7 to 10 days. So that's probably the number one thing that we're looking at right now, and obviously increasing amount of the new positive cases. So the message is just stick with the basic program that that we've advised really from the beginning, but certainly since the beginning of May when we went into phase 1. It's still important to maintain the appropriate physical distance. It's very important to exercise good hygiene, wash your hands, do things like that. It makes a difference. And then it's also important, which we advised at the beginning of May and reiterated recently with the Surgeon General, when you can't socially distance and keep that 6 feet, wearing the face mask can help reduce transmission. Very important. And also, if you're in these face-to-face businesses, it's important that the employees are wearing the face mask. And by and large in Florida, I think I've seen that at the businesses. I think that they've really done a good job with this. Obviously, there's some need to improvement. Now, our recovery plan, Dade, Broward, and Palm Beach, where we're still having the most problems, particularly in Dade and Broward, they've been on a separate schedule this whole time, much slower. We've had the rest of the 64 counties went into phase 1 at the beginning of May. And obviously there were restrictions. Businesses would open, but they would have to abide by certain social distancing guidelines. And I think by and large, they did a really good job, whether it was the restaurants, whether it was some of the retail. Obviously the theme parks here have done a lot. And so that's all very good. And sure enough, throughout all of May, very steady as she goes, very manageable caseload. Obviously people come and go from the hospitals. There were some nursing home outbreaks that we had to deal with. But the positivity rate was low and things went well. As we got in that's May and early June. Then as you get into the second week of June, you start to see, some more cases pop up. And then by the third week of June, you start to see more widespread transmission. So what we want to do is just reiterate a couple things. With the restaurants, most of them have done well, but you have half capacity limitations and indoors, and those tables got to be spaced for the 6 feet. That is the way that you can do that in a low risk way. And then recently now with pubs to be able to allow they're treated the same as a restaurant. You go in, seated service only, you have a 50% occupancy limit with the appropriate social distancing. And that is something that is low risk. And our view is, obviously, we want businesses to be able to operate if they can do it in a low risk environment. Now, there have been instances recently where that was not the case. The secretary suspended a liquor license from a place here in Central Florida, that was having really, big parties, which again are just not following the guidelines. And I'm going to kick it over to him in a minute. But basically, what I told him is, this is very easy to understand. We're in a step-by-step process as we've moved forward here. The guidelines are in place for a reason. You're not doing it just to do it. The reason that they're doing it is because you want to have environments that are not going to be huge risks for transmission. And if you don't follow the guidelines and you pack huge numbers of people indoors that are very close, you're creating an environment that you're going to see more spread. And I think we've seen that with some of the younger. And obviously, I'm not harping only on like a restaurant, because most of them have done a great job. And obviously, the social contact that's going on is far beyond just that. I mean, people are hanging out at people's houses, they're doing all kinds of stuff. They're very active. But it is important to follow the guidelines. And if people see a pub or a restaurant, if they're operating at 55%, okay, give them a warning, tell them, hey, 50. But if you go in and it's just like mayhem, like Dance Party USA, and it's packed to the rafters, that's just cut and dry, and that's not just an innocent mistake. And so I told him, no tolerance for that. Just suspend the license, and then we'll move on. And then people will, I hopefully, get the message that these guidelines are in place for a reason. So we want to make sure people are continuing to follow the basic instructions, whether it's masks, social distancing, washing your hands. That stuff will help reduce the spread. And when we went through this in March and took different actions, March and April, the goal was to slow the spread so that we could flatten the curve and have the hospital capacity to deal with the effects of the virus. That obviously worked. We had in April, we were projected by some of these models to have 460,000 people hospitalized. We had about 2,200 at the date that they picked for that. And the hospitals were never threatened to go overboard. We were good. But we also knew that when you flatten the curve, you will have the infections spread out longer. If you don't flatten the curve, it goes up and then it kind of crashes down. So a flatter curve means you're still going to have cases. We said that from the beginning, that the virus isn't gone. We want to be able to get people back to work in a way that is going to mitigate further spread. And so these guidelines are very, very important. And so that's what we want to be doing. And I want to send it over to Secretary Beshears about kind of the message for folks to, particularly the businesses, to make sure that that they're following the guidelines.
Thank you, Governor. Good afternoon, everyone. Thank you for allowing me to be here with you, Governor. I'll be very brief. After discovering that there were some flagrant violations with the Knights Pub, based on contact tracing, it was very easy. 13 employees, we had 28 patrons that tested positive, and due to their advertisements, we pulled their liquor license last night. I've contacted several sheriffs. We're going to continue to do that throughout the state. This is simple, like the governor said. Those that are in flagrant violation, we have ABT officers that are going to be out from now on from 5 p.m. to 1 a.m. checking on these bars and restaurants that are in violation of this, and we are going to issue a warning to those that are trying to do the best they can, but that's not what we're talking about. But like I said, those that were flagrant, we'll be suspending their license. That starts, we started this actually last week. We're going to continue this until we get this right.
Thanks, Secretary. Look, it's just not worth it to try to just go totally beyond these guidelines. I mean, they're in place for a reason. They were done basic on consultation with folks in the medical business communities, the community as a whole, so that we would be able to have low-risk environments operating. And if you're not willing to do that, then you're going to get a visit here from I guess he'll be kind of the grim reaper in terms of business licenses, because there's not going to be any tolerance for it. And I will say most of the folks have done a great job. Most of the citizens who've gone in have done a great job in exercising the appropriate restraint. So we really, really appreciate that.